According to the World Health Organization, Nigeria ranks among the countries with the highest number of preterm birth. Preterm birth complications are a leading cause of neonatal deaths, and many who survive could face lifelong disabilities due to inadequate health care. This also contributes significantly to Nigeria's high infant mortality rate. Dr. Efunbo Dosekun is a neonatologist and the co-founder of Babies Matter Medical Center, a subsidiary of Outreach Signature Hospitals in Lagos. In this interview with the News Agency of Nigeria, NAN, Dr. Dosekun sheds some light on the challenges of managing preterm birth in Nigeria. She urged intending mothers to adopt preventative medical approaches against preterm birth.
Premature baby is a baby that's born before 36 completed weeks. But the babies that really give a lot of problems are the babies that are less than 1.5 or babies that are less than 32 weeks. The ones from 32 to 36 weeks are called late preterms. They still would also be problematic because they have their peculiar problems too. But the ones that specialist units have to get involved with are those that are less than 32 weeks. We must put on our preventative hats, and that starts from even before you get pregnant. I think mothers have to start looking, young girls have to start looking after themselves. Outside this country, it's encouraged once you're 18 to start taking folic acid. Or if you don't want to start so early, once you start thinking of having a baby, you take folic acid. Because that prevents a condition called spinal bifida, which is where there's some abnormality in your spinal cord and lead to so many complications, including death and chronic disability. So we start preparing by taking folic acid. We eat well. There's so much out there now about good nutrition, so people are understanding the importance of good nutrition. Preventing infection, particularly STDs, is extremely important because we have a higher prevalence of STDs and some other viral conditions like hepatitis B, hepatitis C. So we need to work on ourselves. We need to know the women who have medical problems. So when they decide to have children, they need to go to specialists. Just don't go to the midwife or the standard comprehensive general hospital. They need to be with a specialist O&G because they may have a different pattern. The pregnancy may be more difficult, or the fetus that is there. Those people who have genetic problems in their families, they also need to see the specialist to monitor them. People with sickle cell anemia or epilepsy, these are all areas that need some extra intervention. Then the mothers who develop along with time, they develop hypertension. They're just these mothers, and it's very common, particularly in West African mothers, where they develop what they call preeclampsia. They also need to move from primary care level of care or second tier to specialist.
She also tasked hospitals on early referrals for early interventions to further reduce complications.
The challenges we have faced are that when they are referred to us, sometimes it's too late. And we're working very hard with the birthing practitioners to make sure that they come to us early, the babies are referred to us early, or we go to their hospitals and we're there at the delivery. We call that a retrieval team. So we have the right equipment, we have an ambulance, we have a transport incubator. Or the very best is for that hospital, the O&G doctor, to actually come over to our theater and deliver the premature baby, and the baby will be in the unit within 2 minutes. Already at 2 minutes, experiencing optimal medical support.
She advocated for more public-private partnerships to improve the health outcomes of preterm babies.
Worldwide, care of a preterm baby is very difficult. But there are some steps that advanced countries have taken to make sure that the chance of premature babies, particularly the babies less than 32 weeks, babies less than 1.5 kilos, countries try to be sensible and try to put in steps that will prevent a poor outcome. So, Babies Matter Medical Center is working very hard within the team in their interface with the doctors, interface with the government, interface with the community in changing the narrative for the preterm baby. These babies don't need to die. The high death rate, which is globally recognized, there's a lot of anxiety in global health and why is the death rate so high for preterm babies. But it is something that can be solved. We need to form a network of neonatal care, private neonatal care doctors so that we can come together as a consortium and work together with governments so that it's not only those who have money that will have the chance of having their small baby live. We must have some social and ethical, focus in our lives, in our service delivery. It's not only those who have money.